Kanang kerseu thia player youth club ka khot bat kayawer ya kishnang ki badan ha ka them Bhoi district bapin yawan ya shimbenta ha ka inter village knockout football tournament ka Pynlong hau banai September hadu October ajar arpulai hamadan NSCA phaham sim nongpo.
Ka Health and Hygienic Cell jong ka Bhoi College haka South Tarik Nailar arjar arpaulai kala Pynlong ya ka awareness program ka basisngi Halor ka mad drugs abuse and illicit trafficking interactive com awareness talk hapo jong ka te ka college la Pynlong ya ka te ka program da ka jingya trailang ringkat ka D addiction center jong ka downtown hospital bat ka HDFC Nongpo branch. La shimbenta haka neka program dagi samla pule jong ka neka college haka balawan ban ajing hikai da u Dr. Prabir Thakuria. Haka neka sngi la don langru u principal ka neka college u branch manager ka HDFC Bank Nongpo branch Halor nalor iwipan.
On this topic what is given here, because we have specialists here who will talk on that. If I talk and if I make mistake, he will really say something to me like that. So I will not talk on that. Sir will talk, okay? We give him enough time to talk on this matter. But one thing is very clear, that this, okay, topic we have put here today for the students' interaction. I will request also sir to add a little bit on stress also, because that is another issue also of the students at this age when they come to college, as they are growing up slowly and slowly. So, with these few words,
and our college students are not free from all these social evils, though in a much lesser degree in and around Nongpo. That's what I feel. But when the doctor came and he told me that many patients are coming down from Nongpo to downtown hospital for treatment, I was a bit shocked and surprised. So this is very relevant. This program is very relevant in today's times, and I believe that the interactive section that we will be having with the very erudite, famous consultant psychiatrist from downtown hospital, with him, and whatever doubts, whatever problems you face, you can readily interact with the doctor and get enough advice and solutions to whatever problems that you face. It is at most important that you refrain from the use of any abusive substances. It is, as a student, you should never fall a victim to this. Moreover, this sort of program should help you to cope and to tell your neighbors, your people around in your village, the bad effects, the ill effects of drug use, and how to prevent these crimes that is slowly eating the society. That is one of the aim of this function. So you must be volunteers in creating awareness wherever you live. That's my advice to you. Thank you so much, HDFC Bank Manager and Chief Guest today, Mr. C.G. Jayendra. I am very happy and thankful to you for sponsoring this program, which otherwise would not have been taking place. And I am very happy also to welcome Dr. Prabir Thakuria, who was, in spite of his schedule in the hospital, agreed to come and interact with us. Thank you so much.
This program started with a very positive note sir. I like that particular song, and our generation actually needs this kind of thought. If it is a song, we should follow this song by heart. Myself, you all know, myself, Jonathan Bhoi. I am representing the ACFC non-co branch. I am feeling honored, overwhelmed to be a part of this prestigious scholars. I thank you for giving us the opportunity to be a part of your journey. Mr. Singh sir, Principal sir, and the delegates from the downtown hospital. Okay, they are the best person to give you the actual advice, the guidance on the topic that we have decided. Okay, I again would like to thank the college authority, because we have been associated with this college for a long time. We are thinking of expanding our relationship in future also. So, to continue with that support, we require the new generation support as well as the college also. My colleagues are there, I am there, so we are there to help you, in the field of education and financial services as well. The topic, I would not put light on the first line, that is drug abuse and illicit trafficking, but when it comes to stress management, I think we suffer a lot, to be very frank, because in a financial organization, this is very relevant. In a financial organization, we do not do any hard labor, we do not have to go.
Okay. So this will not be a presentation like any formal thing. It will be more of an interactive sessions. At some point of time, if you have some doubt, you can all ask, and I will be very happy to reply as much as possible to your satisfaction. And please bear with my voice. I have some problem with my throat, so the voice is not that clear. Is the voice okay? Yes. Okay. Now, right? Okay. So why all of you are here in the college now? To learn, right? And this why learning is important for you? So because in future you will need the knowledge that you acquire here, the academic and the non-academic, and that will help you with your livelihood and other things, other aspects that you are going to face in your future, right? Okay. Now here I am just going to tell you a little story about one of my patients. Okay. This guy was 25-year-old and came to me with a complaint of forgetfulness. Okay. It's very unlikely that a boy of 25-year-old present with complaints of forgetfulness. This is not common. You see that kind of cases when the people are old, they have dementia and that kind of stuff. Now, when I went into the history, what he told me is that he regularly uses alcohol for last around 4-5 years. Now, 4-5 years is not a very huge time duration which should affect the person. Now, then when we inquired, what we got was that when he was studying in his graduation, he was doing BCA, then he had to do some presentation. Now, while this presentation he had to do, he is a person who has some amount of anxiety. Some people have anxious trait. These people usually remain anxious all the time, and they are very scared. And sometimes they also have social anxiety, like interacting with people that makes them that anxiety even worse. So this guy had a social anxiety. So whenever he has to deliver a talk in the class, he feels very uneasy. And whenever he is very uneasy, he cannot deliver at all. Now because this course demands that he present this number of presentations in the class, so he would otherwise fail. So he was searching for a way to deliver the talk at the same time manage his anxiety. Now what came as a solution was, one of his senior told him that before your presentation have 2 packs of whiskey and all your money is gone. Okay. So this guy believed in that. And it really works. For short time it really works. Because alcohol is basically a brain suppressant. It suppresses, so it gives a slightly relief feeling. So this guy took it and then he presented, and he could present it well. And that gave him a reinforcement that alcohol helps him, and now he don't have to worry because he has a magic pill in his hand. Whenever he needs it, he can take it and he can deliver on social anxiety part, no issue. Gradually it continued because his baseline trait was that he was always anxious. What happened is that he started to use it regularly because whenever he takes alcohol, he feels relaxed, calm. Now, as a result, what happens is that his alcohol-seeking behavior gradually increased, and then over 1 or 2 years, it became a daily phenomenon. And then the quantity of alcohol increased. Okay? And over next 3-4 years, ultimately, when he landed up in my chamber, he started to develop this forgetfulness. And once we investigated with CT scan and other investigations that we had to do, what we found is that his brain has already shrunken. Okay? The brain picture of this 25-year-old boy was like that of a brain picture of 70-80-year-old person. And the damage that is done in the brain is a permanent one. It is gone. Once gone means gone. It is not going to come back. Now this boy of 25 years old, alcohol came to his life because he was trying to manage some other problem in his life, that is the social anxiety and other anxiety. He took alcohol as a medicine, and then the net effect of that is that it helped him to perform well in his BCA or presentation, but net result is that total very significant destruction of his brain. So now he cannot remember things. So now even if he has acquired the degree, how is he going to continue with the job? How is he going to get a job? So that short period of benefit ultimately has ruined his entire life. Okay? And then thereafter there were things that we did and we managed that case. That's a different issue. Zardayanol. And the smoking is that cigarette. So what it does is that the smoking one, it causes damage to the lung. These are permanent damages to the lung. Okay? Next, please go ahead. So here, this is the blood vessel. One of the most common problem that nicotine causes is the obstruction of blood vessels. And that obstruction can happen in any part of the body. If it happens in the brain, there will be stroke. If it happens in the heart, there will be heart attack. If it happens in the kidney stroke. So these areas are gone. Whatever area is gone in stroke. Then, so it damages the arteries. This is the mouth of a person who uses tobacco, smokeless or smoking. This white patch that you see is called as oral leukoplakia. This is a pre-cancerous lesion. It means before cancer disappears. Okay? So these are the signs that someone has to stop, otherwise cancer is coming. Next, this is the oral cancer. I'll just show you. This area is the oral cancer. You see, this is oral cancer. Next, these are the oral cancer. Okay, this all appear because of tobacco. What happens is that tobacco increases your risk of developing cancer in this area by 30 times. It increases the chance of you developing cancer in the kidney, stomach by around 15 times. So that is what it happens. Next. So the next substance is the cannabis. Cannabis is also very widely used. You have seen, this is the cannabis leaf. People use it as a joint or sometimes they use it as a bomb. Okay, have you heard anyone seen anyone using tobacco? Cannabis? Yes. So what it does is that remembering multiple small things and many times forget small daily things. So this is a very common thing that happens to most of us. This is not a illness, don't worry about that. When we are preoccupied with multiple things, when we are having some amount of anxiety, then what happens is that we cannot focus on that particular thing for some time. Okay, because we cannot focus well, we cannot retain in the brain well. And because we are anxious, we cannot recollect it well. This is also what you see happens when you are nearing exam. You read so many topics and then the next day you feel, I forgot everything. My brain is empty. So this happens because you have not focused well, you were anxious, you were at pressure in memorizing things, so you could not read well, focus it well, could not register it well, and when the time came, you probably will not be able to recollect it well. But at that time, don't get scared that you have not memorized, you have not forgotten. It's there in your brain, you just need to calm down, you just need to somehow